Hi, good evening, and welcome to this live session on the most frequently asked long essays for your university exam. Uh, Last Tuesday, we had discussed about one of the most frequently asked long essay from the lower limb, and that was the topic of the gluteal region, where we discussed about the hip joint, right? And today, we will talk about one important long essay that is asked as a 10 marker or a 15 marker from the region of head and neck. No matter like which university you open the question paper from, let it be RGHS, MUHS, the Kerala University, all university from head and neck, we often get one question, and that is the topic of the parotid gland, right? So what we'll try and do now in the next 20 minutes is we'll try how to present the answer if this is asked in university exam so that we can score maximum. So that is why I have not divided this topic into any subheadings. I have simply given the question as describe the anatomy of the parotid gland. Now, when the question is like not subdivided into headings, how do we go about? It's always better to start with probably a line of introduction about what exactly is the parotid gland, right? As we know, parotid gland is the largest of the three pairs of, we can add the major salivary glands. So we have parotid, submandibular, and sublingual, out of which the major salivary gland is the parotid gland. First line. Then, where exactly the parotid gland is located? Now, the parotid gland lies over a mold formed on your parotid region, and this we will call it as the parotid bed, right? Now, this parotid bed has an anterior, a posterior, a superior, and a medial limit. You don't have to write a diagram for this, not at all important. All you need to mention is what forms these boundaries of the parotid mold or parotid bed. Anteriorly, what do we have is we have the ramus of the mandible, right? So anteriorly, we have the ramus of the mandible. So if we have ramus of the mandible anteriorly, what do we have posteriorly? Yes, we have the mastoid process. You're correct, right? Then what about superior and what about inferior? So what do you have above? Anteriorly ramus, posteriorly, as you said, mastoid. What do we have above? We have the opening of the external acoustic meatus as well as the temporomandibular joint. Lower down, what we get is the styloid process. So this is the area where we get the parotid gland. Once you introduce what is parotid, this comes next. Where is parotid located? We are done with this. Then we will move on to the coverings. Usually, when the question is subdivided, capsule will form an important component of parotid. Why? Clinical importance of this capsule. Parotid gland is covered by an inner true capsule and outer false capsule. The inner true capsule is formed by the condensation of the connective tissue stroma, right? So this is formed by the condensation of connective tissue of the parotid gland, whereas the false capsule is formed by splitting of the investing layer, right? Investing layer of the deep cervical fascia. Now, can someone tell me the deep cervical fascia actually forms a thickening, and this separates the parotid and the submandibular. What do we refer it to as? Yes, that is the stylomandibular ligament. Correct, right? So investing layer splits to enclose the parotid and forms the false capsule. Why we should know about this? This capsule of the parotid has a clinical importance. Whenever we have enlargement of the parotid, especially in children, it's due to a viral infection referred to as mumps. This results in stretching of the capsule, And this stretching of the capsule will result in severe pain, right? Now, in your exam, what they ask is, what is the anatomical basis for this severe pain? There are two causes, remember. One is the tough, unyielding nature of the capsule. The capsule is tough and unyielding, and it has very rich sensory innervation by a nerve called as the greater auricular nerve, right? So this is why any swelling of the capsule of the parotid is very painful. Mumps is extremely painful because of these two reasons: tough, unyielding nature of the capsule. The second thing, rich sensory innervation. So we discussed about where is it located. We discussed about the capsule and its clinical relevance. Now, what about the presenting parts? First, try and list all the parts of parotid. The parts of the parotid include, it will have an apex, it will have 4 surfaces, 3 borders, and a base, right? Now, let's start with the apex. The apex of the parotid is always directed downwards, and this is related to a very important branch of facial nerve. And what is it? It is related to the cervical branch of facial nerve. And this, as we know, will supply which muscle? Can you tell me, out of the 5 branches we have over the face, cervical branch should supply what muscle of the neck? Yes, this supplies platysma, right? So this is the cervical branch. Along with this, we also have anterior and posterior division of the retromandibular vein, right? So these are found on the apex of the parotid. Then, what about the surfaces? Out of the 4 surface we have, the superior surface near to external acoustic meatus is what we refer to as the base, which is intimately related to external acoustic meatus. Now, this surface is also related to a nerve which goes towards the scalp. If you recall the anatomy of the scalp, we have a muscle called as occipitofrontalis. Can you tell me, frontal belly is supplied by which branch of the facial nerve? Again, try to recall the 5 facial branches we have discussed. What is the name of this branch? It is temporal, correct, right? So this is related to what nerve? The temporal branch of the facial nerve, right? Along with this, we also have the superficial, right, temporal vessels. Done. So below cervical branch, above temporal branch. Rest of the branches come from anterior border, right? Done. Now, this is regarding the base, which we also refer to as what? Superior surface. Then, the next surface we have is superficial surface, which is related to skin. Now, ask yourself, if I have to reach the parotid, what are the layers that I need to dissect? I need to dissect the skin. Deep to the skin, I get superficial fascia. Then we get the parotidomesenteric fascia or the capsule, in which we have the lymph nodes, right? And then we have the platysma. So these are the structures which are related to the superficial surface, right? Even if you mention skin, superficial fascia, parotid fascia, this is enough, right? Done. Then what about the other 2 surfaces? Other 2 surface, anteromedial, posteromedial. Anteromedial surface is related to one bone, as we just saw, and then 2 muscles. Anterior-medial, it is related to the ramus of the mandible. Now, can you tell me, what are the 2 muscles attached to the ramus which actually look like mirror images? One on the outside and the other on the inside. First, tell me about the muscles of the ramus on the outer surface. What is it? Yes, that is the masseter muscle. Correct, right? So we have the masseter. If masseter is present on the outside, what is present on the inside of the ramus? Yes, it is the medial pterygoid. Right? So remember, when you look at your textbook, remembering the relations look very tedious, right? There are a number of structures given, but we just need to simplify it. Anteromedial and posteromedial, one bone, two muscles. Bone is ramus, muscles are masseter and the medial pterygoid. Now, what do you have on the posterior aspect? What bone? We have the mastoid process. And what muscle is attached to the mastoid process? On the outside, we have the sternocleidomastoid. On the inside, we have the posterior belly of digastric. So even if you mention these two, this will be enough for your examiner. These are the three relations on the anterior and posterior side. Every paper evaluator will remember, right? So don't try to write everything. Mention three structures anteromedially, three structures posteromedially. Last, regarding the presenting parts. So we have discussed about apex. We have discussed about surfaces where we discussed about superior, superficial, anteromedial, and lateral. And this is the diagram that I would suggest you to write. Okay. Now this is showing the transverse section of the parotid. We will identify the structures. This is the superficial surface of the parotid. This is the posteromedial surface, anteromedial surface. Superficial surface started with skin, superficial fascia, the lymph nodes, and the parotidomastoid fascia. On the anteromedial side, the ramus, masseter, medial pterygoid. Posteromedial surface, mastoid process, sternocleidomastoid, posterior belly of digastric. If you can write this, this is enough for a diagram. This is the first diagram the examiner would expect. So first diagram. Then once we have discussed about surfaces, the next thing is about the borders. There are three borders of the parotid: anterior, then we have posterior, and we have medial. In the same image, if we identify, this is the anterior border towards the masseter. Towards the sternocleidomastoid, we have the posterior border. Towards the pharynx, we have the medial border. Right? What structures are related to it? Among all the three borders, the most important border will be the anterior border, because this is where the branches of the facial nerve will emerge out. Right? Now, what are the branches of the facial nerve we have here? We already have the temporal branch coming from the apex, the base or the superior surface. From the apex, cervical branch. So what are the three branches left? So we are left with the first, the zygomatic branch, right? Then we have the upper buccal branch or the facial nerve. Then we have the lower buccal branch, right? We have the parotid duct. Then we have the marginal mandibular branch of facial nerve, right? If you mention zygomatic, upper buccal, lower buccal, and marginal, these four nerves are good enough, and one duct, that is the parotid duct, right? This is regarding the anterior border. In the posterior border, one important nerve again, and we refer it to as the posterior auricular nerve or posterior auricular branch of facial nerve. Two borders, anterior, we have zygomatic, buccal, marginal mandibular, posterior, posterior auricular. Medial border, pretty simple. It is related directly to pharynx, as we just saw. This is regarding the borders. And for the borders, this is the diagram we need to write. Okay. So anterior border, which we just learnt. Then posterior border, where we had the posterior auricular nerve and vessels. This is the base, and medial border will be present deep. This is regarding the main presenting parts. Then within this long essay, you often get a subdivision with respect to what are the structures present within the parotid. Now remember, this can also come as an MCQ for you. You need to remember how these structures are present from superficial to deep. In your MCQ, they will ask you to arrange from superficial to deep. How do we do it? So remember, the first structure we have is the facial nerve. Then we have the retromandibular vein, and then the termination of external carotid artery, right? Just specify it as termination. Again, I'll tell this will be a 3-marker question for you, and this will be also an MCQ for you, right? What we need to remember, we need to remember how the structures are arranged from superficial to deep. Are we clear? Right. After describing everything else related to parotid, the last thing is to mention about its innervation. Maximum marks will be kept for this. So let's try and understand the secretomotor nerve supply of the parotid. Right? Remember, secretomotor nerve supply of the parotid starts with the inferior salivatory nucleus. This will carry the fibers to the glossopharyngeal nerve. Glossopharyngeal nerve will give rise to a tympanic branch. Remember, you can just write it as a flow chart. No need to write the diagram. Inferior salivatory nucleus, glossopharyngeal nerve, and tympanic branch. This gives rise to a plexus called as tympanic plexus. From this, we have the lesser petrosal nerve, right? The lesser petrosal nerve will ultimately relay to this, you need to highlight, otic ganglion, right? So from otic ganglion, we have auriculotemporal nerve, and auriculotemporal nerve will innervate the parotid gland, right? Now, this flowchart can fetch you 3 to 4 marks because in the topic of parotid, maximum marks will be kept for this secretomotor innervation. So remember, inferior salivatory nucleus, glossopharyngeal nerve, its tympanic branch, tympanic plexus, lesser petrosal nerve, all this preganglionic nerves. All the nerve fibers get relayed at where? Otic ganglion. Now from otic ganglion, this will be relayed to the auriculotemporal nerve and then supplies the parotid. This is how we must describe the clinical and secretomotor innervation of the parotid gland. So secretomotor innervation will be the last part, and this is how you need to structure your answer if the question is not subdivided. Fine. So remember, we took 20 minutes to discuss this question. You can take 20 to 25 minutes to answer if it is a 10 marker and not more than this. And this is how you will concise and you will present your answer so that you will get a maximum out of the allotted marks. Fine. Now, if you have any questions related, you can ask before we close. Do we need to mention about the arterial supply? My suggestion, no, right? If you have to mention, just mention it in one sentence as it is supplied by transverse facial artery, which is a branch coming from superficial temporal. That itself is enough. In parotid, what they look for is relations and the secretomotor innervation. Anything else that we need to address? Right. Fine. This is one question that I wanted to discuss for this week. Next week, do let me know what topic we should come up with for the long essay discussion, and we'll do the same. And Thursday, we will discuss about the histology slides as we did last time. Again, the same time, 7. We will discuss about one more important slide from histology. Last week we had discussed salivary glands, and this week we will come up with a few general slides for discussion. Thank you. Thank you for joining.